In this video, we will look at two different scenarios. Firstly, we will look at ordering insulin for the remainder of the day and ordering a first dose for the next day. And the second scenario that we will look at will be ordering a late breakfast dose. Before we place any medication orders, we always navigate to the MAR or the MAR summary, and we check to see the medications that are already charted for our patient. I've navigated to the MAR summary and I'll refresh my screen to make sure I'm seeing the most recent information. And I can see that there is no insulin charted for this patient, so I can go ahead and place some orders now without the risk of ordering duplicates. In this example, it's 2 p.m. and we want to chart insulin for today, and we also want to chart a breakfast dose for tomorrow as well. You plan to chart the remainder of the next day's insulin after the ward round tomorrow morning. We'll click on Add, and we will add an insulin care set for our patient. All insulin orders start with the word insulin, and we can filter the results by putting in a little bit more information to narrow the results down. This is our insulin care set, and a care set is a group of orders that are put together for our patient's care. We have patient care tasks at the top, which are nursing orders, and it's very important to check the orders screen and see whether the patient already has blood glucose monitoring. And if they do not, it's important to make sure you order a task from here, as this will give a task to the nursing staff to perform the blood glucose monitoring. The insulin dose check. Every patient who is on insulin needs the insulin dose check order on the MAR, and we only ever need to order one of them. Just from checking on the MAR summary, we saw that there was no insulin charted and there was no insulin dose check. So we will leave this order ticked because we do want this dose check to appear on the MAR. It is currently Thursday, and we're going to chart insulin for the rest of today and for tomorrow morning as well. As previously mentioned, it is 2 o'clock in the afternoon, so we won't be placing any orders in the 8 a.m. or the 12 p.m. box, as this will generate tasks which will be administered in 7 days' time. We'll put in our evening dose, and we also know that we want a dose to be administered tomorrow, so we'll place an order for Friday's insulin. Always remember that insulin is ordered on a daily basis, and we do not order by clicking in these boxes here, as this generates errors and not orders. To generate insulin for subsequent days, we click on the orders, so we always order our insulin vertically. And we'll put in tomorrow morning's dose. By clicking back onto my Thursday insulin order, I can see that I have ordered the remainder of today's insulin here, and I've ordered tomorrow's dose here by clicking on the Friday insulin order. So I'm going to click OK. And I'm getting an alert on the screen letting me know that interaction checking will not occur on this dose check here because it is not a medication, so we can safely click OK. Before we sign off our orders, it's important that we always review what we're actually ordering here. So we're double checking, we're ordering our dose check, we are ordering our NovaRapid 6 units for this evening, and we can see the start time and the date, and we are ordering our breakfast dose of 6 units for tomorrow morning. Once we're satisfied with those orders, we can sign them off. And refresh our screen. And now we can go to the MAR summary, and we'll refresh the MAR summary to pull those orders through. Now we can see we have our dose check, and we have our dose for this evening, and we'll also have a dose for tomorrow morning. So now we'll follow in our scenario that the next day has arrived, and now we want to chart the lunchtime and evening doses for our patient. We don't need to order another care set to do this. We can go to our order screen, and we can locate our order for the morning dose. So we can see this one here. We can select that order, which currently only has the morning dose, and we can actually add that lunchtime and evening dose by right-clicking, modifying, clicking in our dose, and then adding them in here. We have now added in the additional doses for the rest of the day. We can now click Orders for Signature, And again, we double check our order to make sure that it is correct. We check the date, we check the start time, we check the units, and we can sign. And refresh the screen, and we always navigate back to the MAR or the MAR summary and refresh the screen and just make sure that that information has appeared on the MAR for us, and we can see here that it has. That is the end of the scenario for ordering remainder of the day insulin and also the dose for breakfast the following day. The next scenario that we will look at is when we want to order a dose of insulin for breakfast, but we've actually missed the breakfast dose time. To demonstrate this, I will open up a different patient's chart. When I refresh my screen, the first thing I'm going to do is I'm going to go to this patient's chart, I'm going to go to the MAR summary, and I'm going to see if they already have insulin charted. And I can see here that yes, they do have insulin charted, and they've also got a dose check as well. After carefully checking the MAR, we will now go to the order screen and we'll order that breakfast dose. We click on Add. And we order insulin once only. Always be careful when you're selecting your care set, because as you can see here, we have an adult and a pediatric care set. The care set will appear on our screen for us, and as you can see here, it is categorized by short-acting, long-acting, combination insulins and hypoglycemia treatments, as well as consults down the bottom here as well. We select the insulin and we select the dose. You'll see that this is a once-only dose, and the first dose priority will land at now. So we want to administer this now because this is a late breakfast dose. We will click OK and done, and we can sign this one. So what about the insulin for the rest of the day? To do that, you would then go back to ordering a care set as per normal. So you would click on Add, order your insulin care set, when we reviewed the MAR, we saw that there was already an insulin dose check on the MAR. So it's important now that we remove that insulin dose check because we don't want to have more than one. We select the day of the week. We've already placed a once-only order for our morning insulin because we missed this breakfast dose time. So we placed our once-only order for that. So we can skip this morning dose and we can go ahead and we can chart our afternoon and evening doses. We can click OK, click done on our cert screen, and now we'll double check and we can see the orders that we're placing here. There is no dose check because we know we already have one on the MAR. There is no morning dose because we've already charted that as a once only because we missed the breakfast dose time, and we can see we have our afternoon and evening doses and the start time for that order. We can sign that order off. Refresh our screen, and always remember to navigate to the MAR, and always remember to refresh the MAR because that will pull through the most recent information. And there it is showing there for us. Always remember when you're placing insulin orders, never to copy your insulin orders. Every day of insulin needs to be ordered as an individual day's order, and we order that vertically in a care set. We can't order insulin horizontally by clicking on the boxes for the days of the week because that generates errors and not orders. Don't forget to always review the MAR summary after you've placed an order or deleted an order or edited an order or made any change at all to any orders. Always check the MAR summary to make sure that that information has pulled through, and remember to refresh your screen. Please do not change the start time of insulin to accommodate a late morning dose of insulin. As this video demonstrated, rather than changing administration times, you can order a once-only dose of insulin and it can be administered as a now or a stat dose. Do not order multiple dose checks. As we saw in this video, we checked the MAR, we saw that there was already an insulin dose check, so we unticked that when we ordered subsequent care sets. We only need one. And if you want to order just a once-only dose, you don't need to order a care set that has up to 4 doses to be charted. You can order a once-only dose, and that care set is called the Insulin Subcutaneous All Types Once-Only Care Set, which has been demonstrated in this video.